Hello and welcome to part 2 of our Power of Nursing podcast for the RCN in Wales. This second part of the podcast will focus on the discussion that Denise Kelly had with RCN members in Wales in relation to the Fair Pay for Nursing campaign and focuses on the real successes they achieved as part of the industrial action in Northern Ireland. Denise is the Vice Chair of the Trade Union Committee with the RCN and is an active steward and health and safety rep and was key to the campaigning activity in Northern Ireland. We're very grateful to Denise for sharing her time and expertise with us in Wales, and I hope that you'll find the information from Denise very insightful and helpful in supporting the Fair Pay for Nursing campaign in Wales. Denise's presentation picks up midway through her introductions to the chronology of the campaign. So without further ado, it's over to Denise Kelly.
During early to summer 2019, campaign activity included increased member and public engagement events, as well as significant media and political activity. We had written to MPs, we had lobbied MPs, we had meetings with them. We also used our power of influence amongst church leaders, faith leaders, different businesses. We really had to galvanise and get people on board because there was a bit of resistance out there. There was people thinking, oh, nurses are being greedy. They didn't understand that we were actually getting paid less than a nurse in Belfast, Birmingham, all around the UK. We were getting paid because parity had been broken in 2016. So to enable us to do that, we had established local organising committees, and this was within our branch areas, and our ethos and mantras the whole way through was to educate, engage and empower, and really to focus the campaign for safe and effective care and also for pay parity. So the member and public engagement events included asking our members and public to indicate support for industrial action. So we were doing temperature checks the whole way through it, just to gauge and make sure that we had the support, and if we didn't, what areas did we need to focus our target in, just to increase that level of intensity that we had and to make sure we were getting the right messages across. So following the various campaign activity, including consultation and engagement events, the campaign then progressed to a formal balloting on industrial action. The RCN Northern Ireland Board, at a meeting held on the 29th of July 2019, made the decision to formally ballot the RCN Northern Ireland members. RCN Council had agreed in April 2019 that to receive a mandate for industrial action or strike action, the RCN Northern Ireland must achieve at least a 30% member ballot return rate. Now, this was not a legal requirement. In Northern Ireland, the legislation relating to industrial action does not have, unfortunately, the higher thresholds or expiry dates that are introduced everywhere else in the UK by the Trade Union Act 2016. So thankfully, we weren't constrained by those draconian laws that were put in place with the Trade Union Act. So the Trade Union Act requires that where ballots involve workers within important public services, at least 50% of those entitled to vote must participate in the ballot. And in addition, at least 40% of those entitled to vote must vote in favour for the action to be lawful. The Trade Union Act 2016 also restricts the period of validity of a ballot, as they call it, the ballot life, to 6 months or 9 months if there's agreement on both sides. Again, this did not apply to Northern Ireland, but that's what we need to be mindful of now as we move forward with our Fair Pay for Nursing campaign, because we do have to meet those thresholds. So background to disputes and ballot. Following the obtaining of advice from Senior Counsel, 2 formal trade disputes were lodged in September 2019 with our HSE employers and the Department of Health in Northern Ireland, one relating to safe and effective staffing and the other relating to pay disparity. The ballot was launched on the 6th of October 2019 for a period of 4 weeks. Intensive campaigning by staff, board and members was undertaken throughout this period. And that involved setting up closed Facebook pages, setting up WhatsApp groups, establishing industrial dispute and strike committees, and we did have at points nearly daily communication with each other, and it was about getting information intelligence from people on the ground, looking at what were we doing well, what could we do better, how else can we reach out and engage with members who maybe aren't happy about taking industrial action. We also devised a lot of FAQs, so we had a lot of information. Again, communication was key. We had to have everybody on board, we had to have them influenced, and we had to have them inspired to know that this was the right action to be taken on behalf of their profession, and more importantly, for patient safe and effective care. So finally, moving forward, The Northern Ireland Assembly was recalled on the 11th of January 2020 and a new executive was formed. It can go without any shadow of a doubt, and it was reported in the national media, that they feel it was due to nursing that our devolved government was re-established, and I think that's credit to the RCN as a whole. Throughout our campaign, and as you've seen with Dame Donna and various other members of staff, we could not have done this without having the rest of the UK and our members in the RCN and our RCN family been at our back. They really were the wind behind our sails, and it just shows you how collectively everybody working for the same common purpose, you can deliver and you can win and succeed. It's about building that power base. So our newly appointed Minister of Health, Robin Swan, emailed all health and social care staff when he took up office and indicated that his first priority was resolving the industrial dispute as quickly as possible. Following discussions, the Minister for Health wrote to the RCN and other health trade unions on the 15th of January 2020 with a framework agreement containing proposals for addressing the trade disputes, namely relating to restoring pay parity with England and addressing safe staffing. The RCN industrial action was paused on the 16th of January 2020 to allow fuller consideration of the framework agreement and consideration of a consultative ballot for RCN members in relation to the framework agreement. Further intense negotiations and further clarification on a number of points were also reached. As with all things, member involvement, member education and members being fully involved in the process was key, and it was always going to be a member-led decision that would decide the outcome of whether we accepted or rejected this proposal. So we began a consultative ballot with our members on the framework agreement in February 2020. An extensive series again of member consultations, information sessions and engagement events took place right across Northern Ireland during this period. Thankfully, the majority of RCN Northern Ireland members voting in the consultative ballot voted to accept the framework agreement and proposals. The RCN Northern Ireland Board at our meeting on the 24th of February agreed to respond to the Minister for Health and Department of Health to indicate acceptance of the proposals contained in the framework agreement and the ministerial commitments. The RCN Northern Ireland Board also agreed that the trade disputes on both safe staffing and pay disparity would remain in place until satisfactory implementation is achieved. Our strike action and industrial action and disputes are paused at present, they're not ended.
A huge thanks to Denise for sharing that information with us and being kind enough to give her time to present that to members in Wales. I hope you really enjoyed that, and as always, if you'd like to get further information and get involved in the Fair Pay for Nursing campaign, please do have a look at the RCN website at www.rcn.org.uk, and I look forward to you joining us for future podcasts.